The personality disorder that we'll be talking about today is histrionic. Histrionic personality disorder is described as the unstable and intense emotions, also as the distorted self-image. As we know, there's 3 clusters to personality disorders. Cluster A is described as the odd and eccentric. Cluster B, which is where this personality disorder falls into, is described as dramatic. Cluster C is described as anxious, fearful, and avoidant.
Here are some background information. This is one of the most ambiguous diagnostic categories in psychiatry. Researchers studied this theme of hysteria between the 18th to 19th century. Namely, Charcot renamed hysteria as neurosis. Sigmund Freud redefined neurosis as a re-experience of past psychological trauma. This is where histrionic personality disorder came from.
Fun fact: this disorder made its first appearance in the Diagnostic and Statistical Manual of Mental Disorders, too.
This personality disorder, histrionic, can begin at early adulthood. It can be presented by the following criteria from the latest DSM-5, Diagnostic and Statistical Manual of Mental Disorders. They may feel uncomfortable when they're not the center of attention, can act inappropriate when interacting with others, uses physical appearances to draw attention, style of speech is impressionistic and lacking in detail. They also have exaggerated expressions.
People with histrionic personality disorder have many signs and symptoms. Some of the signs and symptoms that they do display is the rapid shifts in emotions, as well as attention seeking, and can act very dramatically with exaggerated emotions and expressions. They also lack sincerity. Other signs and symptoms include their self-esteem, which depends on people's approval on them. These people have a high desire to be noticed and will act dramatically or inappropriate to get that attention. But they do have good social skills, but can be very manipulative.
They also want to be the center of attention, be overly concerned with physical appearance, constantly seek reassurance or approval, be gullible, and easily influenced by others, be excessively sensitive to criticism or disapproval, have a low tolerance for frustration, and be easily bored by routine, often beginning projects without finishing them, or skipping from one event to another. They also tend to not think before acting, make rash decisions, be self-centered, and rarely show concern for others, have difficulty maintaining relationships, often seeming fake or shallow in their dealing with others, and threaten or attempt suicide to get attention.
The cause of HPD is unknown, but scientists and researchers believe that it is a result of environmental and biological factors. Along with this, people with HPD are also most likely to develop substance use disorders and addictions than those without a personality disorder.
There is treatment for this personality disorder, but it should be known that this disorder cannot be cured. Treatments can include medications and therapy. Some of the medication include antidepressants. If depression co-occurs with the condition, bupropion and amoxicillin are some of the antidepressants one can take. Anti-anxiety drugs if anxiety co-occurs with a condition, such as buspirone. But it is recommended for people with HPD to do therapy, more specifically psychotherapy, which is done to help the person uncover the motivations and fears associated with his or her thoughts. But this can be challenging for them because they can exaggerate their feelings and they may not follow what the therapist is recommending.